Today we're going to be talking to Rakan about his labs. So at our very first visit, we did a head-to-toe assessment where I ask 1 million questions and kind of get an overview of what's going on with your health in general. Right? So that was an hour long, all kinds of probing questions, but these are the things that I need to know, right?
Yep.
And then we drew labs. And then from labs, that helps me formulate a plan that is specific to you and exactly what you need, and also taking into account the different symptoms that you've told me. So one of the things that Rakan mentioned to me is that he just feels tired. He doesn't have a lot of energy, you know, and which you would never know when you see him around town, that he is just like really propelling himself through the day, which a lot of people do.
Right.
A lot of people just like get up and they use caffeine. They do a lot of things.
Coffee, lots of coffee,
Yeah, so people are really trying to find these energy sources, but we really need to have that from our base metabolism. So, so there's a couple things that can lead you to not have great energy. One of them is your thyroid, the other is vitamin D, and another is inflammation. So inflammation is huge, and we're going to have a whole section on inflammation. But just starting looking at your labs, so when we look at your thyroid, we can see it is super duper healthy. So
that's awesome.
I know. I'm really, really glad about that. So amazingly healthy. Your B12 level is 615. I like to have it more around 1100.
Okay.
B12 is also energy, but it comes from blood building. So if you're anemic, not that a B12 level of 615 is going to make you anemic, but it's just not enough.
Okay.
So when you don't have enough red blood cells, you don't have enough oxygen, it makes you feel tired.
Right.
So more B12, a little bit better. Too much B12, not so good either. So that's why we do labs. We want to see where you're at. And then D, whole different story. Oh my gosh, horrendous. So 13.9. 30 is the cutoff for deficiency.
I'm way lower than that.
So, and you know, D is really important for energy, super important, but what it's really important for is your base metabolism. So without vitamin D, we run the risk of all kinds of different disease processes setting in because your body's immune system cannot fight things off. Also, it's not great for your bones. So we want to keep that closer to 100. That's where people are finding that you just get much better results. And it's really interesting. A lot of the autopsies of people that died of COVID, they had very low vitamin D. And, you know, of course, that's not the only reason, but having low vitamin D is just not amazing for you.
Right.
So we are going to boost that up. And so what we do for that, when it's this low, is I'm going to give you 14 days of 50,000 IUs of vitamin D.
Okay.
And so all of these things are prescriber grade supplements. Like, please do not run out and try to duplicate this. You've got to get labs and you've got to get actual what the thing is, because supplements are not regulated and so they can be anything. It's really important to get good quality supplements that are exactly what you think they are. And then with the vitamin D, so we're going to do this 50,000 IUs for 14 days. That's going to get you up to 100, and then after that, you're going to need to take 10,000 IUs daily. So in Washington, we simply do not get enough sun. You could go to the top of Mount Rainier every day.
No, I mean it's different because I lived in Florida for a long time. So we would, go suntan and sunbathing, and the ocean is right there. Right. Almost every other day, like at least 3 times a week. So we got a lot of sun. It's nicer weather most of the year. We're always exposed to the sun. Here, we're most of the time we're covered. Although the weather is great, it's just that it's cool. So you're always
we're covered,
yeah.
And then we wear sunblock because we don't want you getting skin cancer. When you wear sunblock, you're not going to convert to vitamin D. Right. So it's just one of those things. It's just we can take vitamin D. Right. So no problems, but we definitely want to deal with that. So we're also looking at sex hormones. So because that is another area where we start to lose energy because we simply don't have enough testosterone, and testosterone gives us energy. It gives us a drive for life, and we want that. We want to feel great every day. Right. So when I'm looking at hormones, another area I look at is PSA. PSA is prostate-specific antigen, and that's looking for prostate cancer. Okay. So really super important. Prostate cancer is very often fed by testosterone, so it is really important before we do any manipulation of hormones that we make sure that we're not at risk for increasing base risk, essentially. So if somebody were to come to me and they had a PSA of, over 3.5, then you really would have to go to a urologist and make sure that everything was okay before we continued on with hormone therapy. Okay. There's a lot of reasons for PSA to be elevated that are not cancer, but always safety is the important thing. So, but we're doing fine, so we're not concerned about that.
Awesome.
But testosterone, unfortunately, is quite low.
Okay.
So it's at 358. You're going to feel better if it's between 900 and 1100. Okay. So we've got to do something about that.
Let's do it.
And we're going to be talking about that later, what exactly we do and how that works. Then let's see what is next. We're going to look at estradiol. So men do have a certain amount of estrogen. It is really important for your inner ear to keep you balanced. It is recycled in your digestive tract, so you need it for that as well. But we don't want a lot. And what happens with men very commonly, especially in our country because we have so much estrogen in our water supply, is that men become estrogen dominant. And a very typical sign of that is that kind of middle-aged grumpy man with the belly. So, poor guy, he can't help it. He has too much estrogen.
Too much estrogen.
Yeah. So this is very symptom driven. There's not really a specific number that tells me. It's with everything. Okay. You don't have any symptoms of being estrogen dominant, nor is your number extremely high. So we're going to assume that he's probably fine in that way. With testosterone supplementation, sometimes we can see that estradiol level climb. So this is going to be something we will always keep an eyeball on.
As long as I'm not grumpy.
Okay, yes, we don't want you grumpy.
We're good.
That would be terrible. Can you even imagine?
Nope.
You're out at events taking pictures and you're like, damn you, smile.
Smile.
You guys will have to tell me if you see that happen, and then I'll know his estrogen's too high. A1C. So A1C is very important for telling us if you are at risk or have diabetes. That's a 3-month rolling blood sugar. So a day-by-day blood sugar is really important because it tells us how your whole endocrine system is functioning, but a rolling 3-month can give us a better idea of, are you becoming diabetic?
Right.
And so at 5.9, you are pre-diabetic, and so we'd need to do something about that.
Yep.
5.7 is the cutoff. So you're just very slightly above that, but you should never be above it.
Right.
Okay.
So hopefully diet and exercise will help lower that.
Yes, diet. That's what we're really going to hone in on is diet, and we're going to be doing a lot of teaching about what is a good diet. And so that'll be in a later segment, and I'm so excited for that. Potassium is a little bit low, again, diet related.
Right.
So potassium is so important for us for a lot of reasons, but really cardiac, super important for cardiac. So I like to keep potassium between 4 and 5.2. So I've given you a list of foods to eat. I really don't want to give you a supplement unless we cannot get this number to come up.
Okay.
So some things that you can eat that have potassium: Swiss chard, spinach, avocado, sweet potatoes, bok choy, white beans, white potatoes, and beets. So bananas do have potassium, but they are not the best source of potassium, contrary to popular belief.
That's what I thought. I thought bananas were the best, but I'm glad.
I think that was like the banana lobby that put that out.
Yep, I believe that.
And then we get down into cholesterol. So, and again, this is an area that people, like you look at Rakan, he's not heavy. So you think, okay, his cholesterol is probably fine. His cholesterol, in fact, is not fine.
It's not fine.
So, yeah, not fine. And so LDL, which is the bad cholesterol, is really high at 172. And the really important thing is, so HDL is your good cholesterol. His HDL level is fine. It's over 39. But when you take the ratio of those two things really tell us a good idea of how prone you are to having heart disease, which we don't want, of course. Right. So we want this LDL HDL ratio to be under 2.5, and you're at 3.5.
Okay.
So again, cleaning up your diet.
Okay.
So that's mainly where cholesterol comes from. Some people do have it as like a familial gene, but we still can clean up that diet. We can still get things better, exercise, and and cholesterol is really important. Cholesterol is the one of the primary ingredients of all hormones. So we need it. We have over 200 hormones running around our bodies doing all kinds of different things. A hormone is simply a messenger telling one part of your body to do something else. So we definitely don't want to get rid of cholesterol. We need it. It also cushions all of your organs inside. So super important, but we do want it in good balance. And so that's really it. So our plan right now is to eat more potassium-rich foods, to start taking a B12 supplement. We talked extensively about the D that we're going to do. I'm going to give you a supplement called Cardio Triplex that has red yeast rice, fish oil, and a few other things. So really good for your heart, really good in addition to diet, pulling down that LDL number. And then in 3 months, we will again check your A1C and your lipids, as well as everything else. So what I do with patients, just depending on their treatment of care, is we can do labs depending on what therapies we're doing, every 3 months, every 6 months, or annually. If your A1C had been perfect, then we would probably only ever do that annually. But because it's not, we're going to want to keep an eye on it and do some more intervention if we have to.
Okay.
Do you have any questions?
No, I'm just really excited. And I mean, you like, just so you guys know, obviously I'm like a photographer, so I'm on the run all the time. So my diet is not great because we run from one appointment to the other. We have to grab anything we can eat. Sometimes you end up at a 7-Eleven, which is not ideal, or McDonald's, which is terrible. I mean, I'm sorry, McDonald's, but I always regret eating McDonald's after I eat it. But that's the thing, it's like, convenience. But then you see the results and you're like, oh, so I've been doing this wrong. So hopefully we can find a system or a way to make it better where I can eat healthier foods when I'm in a hurry.
We will definitely talk about that, and we're going to talk about what to eat at those places, because sometimes we simply have no choice.
Right.
And we just have to. Okay. So, and then in addition to these are the labs that I really, really care about, unless there's something wrong with the other ones, but we will look at your others. So your kidney function is beautiful, your electrolytes, with the exception of potassium, are gorgeous, your proteins are so nice, your liver is happy, you're not dehydrated. I
love it.
I know, isn't it fantastic?
Yeah, that is fantastic.
And your red and whites are all zooming around doing exactly what they're supposed to be doing. You're not fighting off any infection, and you are not anemic. So that's our plan based on the labs. We're going to start looking at some hormone therapy.
Okay.
We're going to do that vitamin D for sure, and we're going to clean up your diet.
And I can't wait.
We can't wait to share it with you.